the state. So it makes sense for us to take advantage of that program. And I think it speaks to a larger philosophy. As much as I do not like our current president of the United States, if he created a program that worked well for us here in Kansas, as governor, I would be willing to implement that program. Part of the reason that Medicaid is ground to a halt here is because of political reasons. They simply did not want to take part in anything that President Obama did or expanded, which is one of the ways that we find ourselves now with a federal government that's ground itself to a halt. I also think that on the health side, and I've toured a lot of rural hospitals, there are some ingenious things going on with some very well-run hospitals around the state, particularly in how they're attracting doctors. And I think we need to look at communities where that's successful, particularly Quinter in this kind of neck of the woods, and then Lakin down in southwest Kansas, and use what they're doing and try to apply it in some other hospitals around the state, because having a doctor in that community is critical. It's not only critical for the hospital, but frankly, it's critical for the overall health of the community and its sense of pride. And so we have to have and make sure that programs are in place so that our hospitals can attract doctors first and foremost. And then finally, to the broader issue of health insurance, I think that the state ought to consider finding a way to pool collective risk for the people that are lost in the middle in the current healthcare system, and I'm one of those. I think the Affordable Care Act at the national level did a great job for lower income Americans, and I think people that already have a system that's provided to them by their employers have a pretty good healthcare system, but those of us who self-insure, particularly farmers, have seen year over year premium increases on the order of 30% or higher. Over a 3-year period, my wife and I's health insurance has increased 105%. It's terrible, and the state ought to be working every day to improve